So welcome back to the Heal Podcast. This is Mimi, and today we have Joshua Montross. He co-founded the Cryozone with his father and brother in 2014. Cryozone is a Dallas-based whole-body cryotherapy expanding nationally. Being a software engineer, Joshua created Cryozone's website, point of sale, email, and booking systems. I started going to Cryozone in Santa Monica when I was at my lowest point with Lyme disease. At the time, my body felt like it was on fire, and going to cryotherapy immediately felt like the fire was being put out. So thank you, Joshua, so much for coming on today and speaking with us about cryotherapy.
My pleasure. Thanks for having me, Mimi.
Yeah. So the first question I have is, how did you get started in the cryotherapy business, and why did you decide to do it?
Well, I originally got started because my father got started. So it's more his story is cool. I got involved. He had hurt his knee, and he had a friend who he played basketball with who told him about this new therapy and that he should try it. So my dad went and tried it, and then it helped with his knee pain. And then he started importing the machines. He was actually one of the first importers of machines in the US, and actually got into the first machine that was in the US. This is back in Dallas. So this is kind of where cryotherapy started, was in Dallas, just by coincidence of the people who immigrated to the US. They moved to Dallas and they brought cryotherapy with them. And then after that, I got involved about another 2 years later when I hurt myself in a car accident, and I had a lot of like chronic pain and wrist injuries and neck and back. And I finally decided I'd give this therapy a try that my dad had been raving about. And it decreased my pain because it lowered my inflammation, and it helped me to be able to use my hands more and be able to type and kind of start doing software again. So really it's like I got into it because of my family, and it helped a lot of us in my family, and even helped my mom. And then my younger brother, he just uses it because we have it. I don't think he has any real pains, but it's still good for recovery for him because he works out a lot.
That's great. I'm sorry to hear about your car accident. I hope everything's okay now.
It's good. It was 7 years ago. So it's been, I'm actually 100% healed now. Like I don't have any arthritis in my hands anymore. I would say cryo was a big part of that, in addition to doing physical therapy and taking it easy for a while.
Yeah. So can you tell us exactly what cryotherapy is for people who have not been to your place?
So cryotherapy, it comes from Greek. Cryo means cold. It's cold therapy. The way we do it with whole body cryotherapy here is we have nitrogen-based machines. So we store liquid nitrogen and we run it through the machine, and it makes it so it encloses your body in really cold air. And we do that for 3 minutes, and 3 minutes of rapid exposure to cold causes your body to basically, inflammation is the main thing it does. Just without a doubt, anybody one session, you'll have less inflammation in your bloodstream. It's just a reaction the body has to the cold is become less inflamed. And I'd say that's what it is. The simplest is like taking an ice bath that's dry,
Right. And so you're in it for 3 minutes. That's the max, right?
Mm-hmm.
3 minutes. Okay.
Some pro athletes will go more. They can do two in a day. If somebody's really injured, they can do 3 minutes in the morning and 3 minutes at the night. But we always take some space in between, just because your skin can't tolerate the cold for more than a few minutes.
Right. And so it's the same effect that you would get like going into a cold bath, like athletes that go sit in those ice baths. Is that the same kind of idea?
Yeah, very, 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 very similar effect. Like the less inflammation, they both do that. This is not a penetrating cold, so it doesn't go into your muscles. It more acts on the nervous system through your skin getting cold and the body reacting. Whereas when you do an ice bath, it has that effect too, but it's almost more intense to do an ice bath. Like it's harder, I think, for most people, and it makes the muscles so you can't use them afterwards. So you can't ice and then go play a game of basketball, but you can do cryo and then go to the gym immediately. And pro athletes are using it before games, and Nike even figured out that you can use it before running, and it boosts your cardio slightly. When you make yourself really cold, it makes you use oxygen at higher capacity later on. So your muscles can take in more oxygen after you do cryo, which basically means you can perform for longer in endurance activities.
Mm-hmm. And how would you describe the feeling when you go in there? I mean, I know how I would describe it, but how would you describe it?
I mean, I think it's like pins and needles, you know, it kind of, it's like standing in a blizzard in your underwear. You know, if you've ever done that, it's hard to explain. So it's the closest thing anybody could really imagine it to. Is it's like turning your shower to cold instantly, and just suddenly you're really cold.
Right. But you're
And
locked in there and you can't get out.
you can get out if you need to get out. We'll always end the session early. And what I like is the feeling afterwards. Like, it's while you're in there, you feel really cool, but once you get out, you step outside, it's not hot anymore. You know, you've lowered your temperature a bit, so it makes the rest of the day more comfortable.
No, I agree. I'm totally a wimp when it comes to cold. But I have to say I can last the 3 minutes, believe it or not. I mean, you guys talk to us the whole time, so it's like you get preoccupied, but I'm able to last, which I was shocked. I was able to last. But I think it's like equivalent to being like stuck on a ski, you know, up on a ski mountain for 3 minutes, like where the lift stops and you're going to sit there for a couple of minutes. It's kind of like, I feel like it's like that, where you're like,
Yeah.
it's cold, but you can deal with it because you know it's about to end.
Yep.
But I thought it was interesting the first time I tried it, I literally didn't even hurt at all. Like, that's how I think inflamed my body was, that I was like, that was 3 minutes. Oh, it didn't even, it actually felt awesome. Like, I felt like, oh my God, I'm getting so like cooled down. So,
Yeah.
yeah. So why does it actually help the inflammation? Like, why does that like feel, is it just is there like, what's going on there that makes it actually, is inflammation actually going away and it's actually going away completely, or is it just making it feel better?
It's actually making it go away. So the way our bodies work is we communicate with these proteins through our bloodstream, and a lot of them originate like in our core. And when you do the cold therapy, the body basically turns off the inflammation proteins. So we like, for some reason, you know, it's like a natural reaction the body has. If we get hurt, the area becomes inflamed. You know, they say it's because it needs to push out, like if we had a projectile in us, we didn't have surgery, you know, as we're evolving. So the body gets inflamed to try to push something out. But if you make yourself really cold, the body's more concerned with surviving. So it stops wasting energy on making something inflamed, because that doesn't really, it's not a necessary thing to survive. So it turns off the inflammation proteins. And then also it turns on the anti-inflammatory proteins. So we haven't, like, our body communicates with the way of telling an area to become inflamed. And it has another protein that tells the area to decrease inflammation. So it affects both of those, the cold does.
Mm-hmm.
And it's system wide. So it's not just like on your knee, this is in your blood throughout your whole body.
Right. Which is perfect for Lyme, because I feel like a lot of Lyme patients have inflammation, right? That's what's causing us a lot of the pain. Have you seen a lot of Lyme patients that have come in? I mean, I know you're in California, so it's probably not as prevalent, but have you seen, or was I the only one that came in with Lyme?
When we were in Texas, I had a number of friends who had Lyme, and customers who were really regular, and it helped them with their G levels and their body pain. So you're definitely not an isolated incident. And it's also like one of those things where we can't claim that this cures Lyme disease or anything, but I've definitely seen dozens of people with Lyme disease happily use this to improve their symptoms, you included. And I think it's really because of what you said. Like, Lyme disease is a systematic inflammation of your whole body. So if we decrease the inflammation, it'll at least make the Lyme disease not as painful, you know, if you're getting pain from the inflammation.
Mm-hmm. And then how long do
It doesn't
people
make it go away is the problem.
Right. No, it's not forever. And that's my next question. Like, how long do people usually, do they make it like a regular practice where they come in once or twice or 3 times a week and then keep doing it forever? Or do you see people are more?
More so, I mean, for people with chronic conditions, they view this as oh, this is better than taking a pill. So it becomes a chronic solution. You know, it's like, if you've got Lyme disease, I mean, you were coming in many times per week to address the issue, right?
Yeah,
So that's
definitely
more common. But if somebody has like one injury, or they hurt their knee or something, that type of person might just come for a week in a row until their knee feels better, and then they'll stop coming. It really depends on what the person's needs are, and if they notice how it affects their energy. And
is there like an anti-aging effect to it as well?
of course, I mean, when you make skin cells cold, it preserves them. So it's like the sun destroys our skin. Cold helps to keep it a little more resilient against the heat. And
Right.
then
So you can
also
go,
for anti-aging, like we have light therapy too. That's I think that's really good on the anti-aging. Like there's like an anti-wrinkle light therapy that goes over the face, and I've seen people improve visibly just in like a month. And then for like the cold, actually, one thing that's nice is it's a dry cold. So people that have more oily skin, it dries out their skin. So it that tends to make people look a little bit younger if they're having oily skin, and then it balances out.
right. So like when the one machine I went into, your head sticking out, but then I've seen
Yeah.
ads for like the cryo, like your facial cryo. Is that a different machine?
Yeah, we have a cryofacial machine. It's separate from the whole body, and that can focus on just the face, or like the elbow, or like an injury, or the
Mm-hmm.
face for toning the skin and decreasing wrinkles a bit,
Mm-hmm.
and also
And the,
decreasing inflammation. Our faces get puffy. So many people's faces are just puffy from being inflamed. So you do the facial cryo, and it just tightens the skin a little bit, and a lot of times, inflammation looks like age, because you're just a little bit puffier. So decrease the puffiness, and people think you look younger, but really you're just less inflamed.
right. No, it's true. So when I go in there, there seems to be like a lot going on, not just the cryo machines. What else? You named two things. Is there anything else that you have in
I can
there?
show you. I'll just show
Yeah.
you. I mean,
Oh,
I'm on
awesome.
this thing. I think I can just go like this. Yeah. So we have the Normatec right here. These are the boots that do like squeezes the legs and flushes out lactic acid. This is the
Oh, cool.
Saluma. Here's one somebody just used. I'm going to clean that soon. But it's a red light and blue light therapy, and it's great on blemishes, wrinkles, and also pain. And then this is the local machine. This is the Penguin. It's good for facials. And then just for good measure, I'll show the whole body because we were talking about it. This is the one that Mimi has used, I believe, right?
Yes. Mm-hmm.
All right.
That's
And then
awesome.
there's
Thank you.
another room with some machines there, but yeah.
This is perfect. So what's your plans? Are you rolling out more stores, or what is your plan with
My
cryotherapy?
plan,
Cryozone.
Cryozone, right now, it's really so much has been affected by COVID.
Mm-hmm.
It's kind of wait and see, because real estate's becoming more attractive. Now it's like for the first time ever in LA, you can rent for less now than you could last year. So I think it's expansions on the agenda, but
Yeah.
also it's really focused on our Santa Monica store here, because we had to close down for 3 months, and we really lost a lot of business in that time. So it's really about rebuilding, and then seeing what we're able to do.
Right. That's good that you're back open, right?
Yeah, really grateful. We're able to open with, there's no customers here right now, so I'm not wearing a mask, but we wear masks all the time in the store. We're adding temperature checks to keep it safe in here, because the purpose of cryo is to help people heal. So we also need to keep ourselves as COVID-free as possible.
Right. This is perfect. Thank you so much. And I would recommend to anybody who hasn't tried cryotherapy, and if you're by a cryotherapy place, to go do it, because it really does help, especially if you're in pain. I have found it's helped my pain and my inflammation. But Joshua, thank you so much.
Yeah, thank you, Mimi.
And have a
See you
great
soon.
day.
Yeah,
Okay,
you
take
too.
care.
Bye-bye.